Hello and welcome to Medical Dialogues. I'm Roshni. Let's look at today's top news. Regarding the stipend hike, Maharashtra senior doctors to get Rs 85,000 effective from current batch. Bringing good news to the senior resident doctors working in the government medical colleges across Maharashtra, the state government has increased the stipend to 85,000 rupees. Previously, the SRs in the state used to get Rs 75,000 as their stipend. Expressing its appreciation for the government, the Maharashtra State Association of the Resident Doctors issued a press release and also announced that the increased stipend will be implemented effectively for the current batch of senior residents. In its press release, Central MARD thanked the administration for their prompt response and continuous support for the welfare of resident doctors. WHO chief urges China to give full access to probe origins of COVID-19. The Director General of the WHO has called upon China to increase transparency concerning the origins of the COVID-19 virus and has expressed a willingness to send a second investigative team to investigate the matter. It has been nearly 4 years since the initial cases of the pandemic were reported in Wuhan, China, as reported by the media. The head of the WHO stated that we are urging China to provide complete access and we are encouraging nations to raise this issue in their bilateral discussions, urging Beijing to cooperate. He also further mentioned that we have already formally requested information from them and also prepared to send a team if they grant us permission to do so. NEET PG candidates who have joined in round 3 of state counselling will be filtered, weeded out before AIQ stray vacancy round process. Through recent notice, the MCC of DGHS had informed that the filter for weeding out the candidates joined through the state counselling will be applied before seat processing of stray vacancy round of PG counselling 2023. Notice mentioned that MCC of DGHS will share the data of joined candidates in round 1, 2, 3 of counselling with all the participating states. Similarly, the participating states will also share the data of joined candidates. Candidates who have joined in round 3 of state will be filtered and weeded out before processing for AIQ stray vacancy round of counselling. PCPNDT Act requires strict implementation but without unwarranted harassment of medical practitioners. In a major relief to a radiologist and his doctor wife, the Bombay High Court has squashed and set aside a complaint against the Nasik doctor couple under the Preconception and Prenatal Diagnostic Techniques Act and its consequential proceedings. Observing the case as a classic example of misuse of powers, the court expressed its displeasure at the harassment caused by the authorities to medical practitioners. In an order dated 7th of September, Justice Bharti Dagre stated that this case highlighted the misuse of power by the authorities and the unwarranted persecution faced by medical practitioners. She observed that this is just another case where medical practitioners are subjected to persecution causing a lot of harassment. Present case is a classic example where it can be said that the respondents have clearly misused their powers. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.